All right, we'll go live here real quick. So, well, hello everyone. I am very excited today. We've got Holly Hess, and she's got all kinds of initials after her name, so I'll let her tell you what all that's all about. But this is Life's Co-Pilot. It's brought to you by Caring Transitions as a free service for seniors, their family members, and caregivers. Today, Holly is a dementia programs coordinator and dementia outreach specialist and dementia friendly Indianapolis liaison for CICOA Aging and In-Home Solutions. Um, she is going to be talking today about CICOA's dementia programs and resources. So I think I got all that word salad out there. You've got a very long list of names there behind you. So, I'll let you talk about the initials if you want to get into all that stuff as well. But Holly, thank you for coming and welcome. And tell us who you are and who CICOA is, and let's just go from there.
Yeah, perfect. Well, I'll go ahead and share my screen here.
All right.
So that you can see all the titles that Jim mentioned that I have, because I do a lot of different things, but it's all in the dementia realm here at CICOA. So I'm our dementia programs coordinator at CICOA. So I oversee all of the dementia work that we do, and it's grown a lot since CICOA started doing dementia stuff in 2017. So I coordinate all of that stuff, and then the dementia outreach specialist role is actually something through the Indiana Dementia Strategic Plan. So that strategic plan put a dementia outreach specialist at each AAA in Indiana. So I serve as the outreach specialist for Area 8. So that's Marion County and the surrounding donut counties. So basically that role is just me giving information and resources about dementia. So doing this is a part of that role. And then lastly, I'm our dementia-friendly Indianapolis liaison, and I'll explain what that means as I get into things. But before I was in this role, I worked as a CNA, so I got hands-on experience working with people in home health, long-term care, and mostly people living with dementia. And I got my master's and bachelor's degrees in healthcare management, so that's the MSHM that you see there. And then I'm also a certified dementia practitioner. So I know a ton about dementia, so feel free to email me with any questions that you have. And if you ask me a question that I'm not sure the answer of, I'm going to say, awesome question. Let me do some research and get back to you. But let me just go ahead and get started and start talking about CICOA first to explain what CICOA is, and then we'll really get into the dementia programs here. Here, I'll fully share my screen. Wonderful. Okay, so CICOA, we are the area agency on aging that serves Marion County and the surrounding donut counties. So you can see here why we call it a donut, because they're all kind of connected to Marion County. But if you're not in our service area, you have an area agency on aging that serves your county in Indiana. So definitely reach out to that area agency on aging for any support or services that you need. We're a non-for-profit, and we've been around for almost 50 years, 51 years this year. So we've been around the community for a little bit now. And our mission is just to empower older folks or anybody with a disability and their families, caregivers, by providing them innovative answers, services, and support that they need to just have that greatest possible independence and quality of life. So if people want to stay in their homes, we want to help them do that. But if they decide they need to go another route, we want to support them however best we can. And here's just some of the CICOA services that we do outside of the dementia programs. So the Aging and Disability Resource Center is really that first kind of stop if you have a question about information that you need, a resource, but you're not really sure where to kind of go. That's really the starting place. And our options counselors will kind of connect you to where you need to go and what services you need from there. So that's the Aging and Disability Resource Center. We also do case management. So we're no longer a part of the pathways part of case management, but we are doing case management for those people with disabilities. We also have private pay case management that just started. And then our community health workers, they do short-term case management. So lots of different options that we have here at CICOA for that. We also do meal support. So we have congregate meal sites all over our service area. We do home delivered meals. We even have a Pet Connect program where you can feed your your animals, your furry friends, right? So lots of different ways that we do that. We also do different home modifications, so different funding sources that we have to help with those minor repairs and modifications. And then also Way to Go, our transportation service. So we do different transportation to medical appointments and things like that. But lastly, I'll share the CareAware program. So our dementia and caregiver programs are in the same department. So if you're a caregiver and you would like some care coaching, you'd like some support, some assistance with maybe just self-care or just, organizing yourself and feeling better as a care partner, we offer wraparound services through our CareAware program. So one-on-one care coaching, really addressing what you need and how we can help support you so that you can stay a healthy caregiver. So that's all the different CICOA services. But again, I'm really going to focus on our dementia programs today. So again, if you have any other CICOA questions, feel free to email me. I'll answer to the best of my ability. But today I'm really going to focus on our dementia programs here. So CICOA started with our dementia programs with Dementia Friends Indiana. So this is a program that is happening all over the country, and there are different state administrators. So CICOA is the Indiana state administrator. So we bought the license for Dementia Friends Indiana in 2017. And so what Dementia Friends Indiana is, it's an education session. We teach people about what dementia is, signs and symptoms associated with dementia, but really how they can be a dementia friend to someone. So we talk about communication strategies and also just different action items that you could do to really be a dementia friend in your community. So really the goal of these sessions is to advance education around dementia, but also reduce the stigma associated with it. There's a lot of stigma all over the country about what people think dementia is. Some people think dementia is like part of normal aging. That's not correct. While aging is the biggest risk factor for dementia, not everybody who grows old develops dementia. There's a difference between typical aging and cognitive changes associated with that versus a sign of actually living with dementia. So really in this session, we define what it is, talk about all the things associated with it, and different communication strategies that you can use if you are interacting with someone you may think or is living with dementia. So again, we started this in 2017, and we do this all over the state, so not just in Indianapolis. We have champions all across the state that deliver these sessions. So you could become a champion and deliver sessions to whoever you want to, whenever you want to, or you could also just sign up to come join a Dementia Friends session that we host. We host public ones, we host private ones. We do these for all sorts of groups. We even have a youth material content. So if you wanted to give a session to someone K through 12, we have a specific session for that age group. So again, this is really an approachable way to learn about dementia. Even someone living with dementia should be able to listen to this session and not feel singled out or embarrassed, because there's no embarrassment to dementia. Dementia is an illness. It's a part of, it's not something that you, ask for, or, need to be ashamed about if you do end up living with it. So, again, we do these sessions for all sorts of groups. So our website, you can see here on my slides, it's just dementiafriendsindiana.org. So if you want to attend a session, you can see our events calendar and look at any sessions we have on there. You can also request a session on our website. So if you want a session for your family, your organization, anybody, really, any sort of groups we can do these sessions with, just request for one. You can email me, or you can go on our website and fill out the contact form. So that's all I'll say about the Dementia Friends session.
I was going to say, I took this class several years ago. I think maybe 17 or I mean, it may have been right there at the very beginning.
Yeah.
And I quote stuff from it probably almost every day. Okay. And then we actually hosted a class at our office for when at one time I was managing several different companies, and so we had all of them come together for this event. So it's well worth it. It's not going to give you like a PhD in dementia, but it's going to give you a little bit of better understanding and kind of make it a little bit less intimidating, I think.
Yeah, no, thanks for saying that, Jim. I'm so glad that you're still seeing value in this session and that you're able to use it in your day to day. So yeah, definitely if you ever want us to come back and do another session, since I'm sure it's changed a little bit since 2017, more than happy to do so. But yeah, thanks for saying that. Wonderful. All right, well, let's keep moving. So I talked about Dementia Friends Indiana. Again, that's really where CICOA started in 2017 with their programs, dementia related. I actually started with CICOA as an intern. So my capstone project through my master's program was to start our dementia-friendly community here in Indianapolis. So it's a different initiative. It's a different program from Dementia Friends, right? Dementia Friends is really our information sessions. Dementia-friendly communities is a whole nother initiative, but it's overseen by the same big organization, Dementia Friendly America. So there are dementia friendly communities all over the state. And so this is a designation that a community receives. So they apply through Dementia Friendly America. You really have to set up a cross sector action team of people who just are passionate about welcoming people living with dementia into their communities and wanting to get them included and involved so that they can thrive. But there's no like set activities that a community has to do. You just apply for that designation, and then based on what your community thinks you need, you do it. So you can see here there's all sorts of communities in Indiana. Indianapolis is just one of those dementia friendly communities, a part of the network here. And Dementia Friendly Indiana Communities has its own website as well. So if you want to see the different communities that are in Indiana, you can check that out there. So I already explained this. And really how I like to explain the difference between dementia friends and dementia friendly is, doing dementia friend sessions could be an activity of a dementia friendly community. So again, not the same thing, but just similarly named. And you can see here, we are almost to 18,000 dementia friends in Indiana to date, which I forgot to mention. But so, like I said previously, my capstone project when I came to CICOA as an intern was to start Dementia Friendly Indianapolis. So, like I mentioned, there's a designation that we had to receive. So, we had to apply for that designation. So, we assembled a cross sector action team of all sorts of organizations, but also people living with dementia are part of the team, care partners are part of the team. Anybody who's just passionate about creating this welcoming environment is welcome to join the team. So, this is just some of the organizations involved in the team that you can see here. We started out with like 10 action team members, and we're up to like 80, 75 at this point of just all sorts of different people that see the value in having a dementia friendly community here in Indy. So you can see our mission statement on the screen here. We do lots of different things to create this welcoming environment. We do community events all over, not only Indy, but CICOA service area. We're doing awareness things. We're sharing resources. We now have a website specifically for dementia friendly Indianapolis. So it has its own resource listing of if you are living with a diagnosis, if you're a care partner, or if you're just a professional or community member. And we have resources divided up in that way. And then we do education things like the Dementia Friend sessions. So our action team, we meet monthly, the third Wednesday of each month from 2 to 3 p.m. And it's a hybrid meeting. So some people come to CICOA or join us via Teams. And we just decide what we want to do for the community. So, back when we started things, we had a kickoff event at CICOA to just let the community know that, hey, we're here. But you can see here from this flow chart that I created in 2025 to just show kind of all that the action team was working on. We're doing a lot of different things in the community. So this flow chart, again, it's broken by our mission statement. So you can see with the community events, all the different things that we've done. We had a state conference this past May, where all the dementia friendly communities came to Fishers, Indiana, and we had an all day conference with different speakers. People living with dementia were on panels, and all sorts of fun things were happening at that conference. And we're planning to have a dementia friendly Indianapolis conference next year. So be on the lookout for that. We do a spring and fall festival each year. So these are just fun community events where people living with dementia can come, but it's not just for people living with dementia. These are intergenerational events. Families can come, college students, seniors, anybody who wants to just have fun. That's the goal of the festival, to have fun and include people living with dementia at these events. So I think I have a slide talking about the upcoming fall festival, so I'll pause on talking more about that. But we also do other things like living well with dementia events, memory cafes, which I'm going to elaborate on. But you can see here lots of different things that we do through the action team. So if you're interested in joining the action team, again, just email me and I'll get you connected from there. So something that the action team's really seen value in having in our community is memory cafes. So what are memory cafes? These are just social gatherings for people living with dementia or any cognitive change. So you don't need, nobody's going to be checking your diagnosis at the door. Really, it's for anybody experiencing memory loss or just wants to be, in this, supportive setting. So for people living with dementia or cognitive change, with their formal or informal care partners. So family members can bring them, home health aides can bring them, whoever that care partner is, please feel free to bring them here. So memory cafes, these are a concept. CICOA does not own memory cafes. Nobody owns memory cafes. This is just something that you can do at your organization. It's just a social gathering for these people. So why we do these is because we want to prevent social isolation. From our research, we know that a lot of people living with dementia are residing in their homes. They're not immediately going into those long-term care communities like the stigma or misconceptions that other people may think. They're at home and they're probably becoming a little fearful of leaving their home. So we want to have these spaces where they can come, feel supported, feel safe, and do something fun. They might learn something new. They might meet someone new. So all sorts of activities happen at these memory cafes. So, you could have an activity planned, or it could be as simple as just having coffee and chatting about something. So it doesn't have to look a certain way. So memory cafes are happening all over the state. So on our Dementia Friends Indiana events calendar, we post all the memory cafes that we know about across the state so that you can sign up for them, or no RSVP required. You can show up to them. And then on our DF Indy website, we have the Central Indiana ones listed as well. But on Dementia Friends, we have everything across the state. So you can see here, this is just some of the activities that they may do at a memory cafe. So Centerwell Senior Primary Care has been an awesome community partner with us. And so at two of their primary care locations in Indy, they do memory cafes once a month. So sometimes it's based on the season. Sometimes we'll sing. Sometimes we'll have ice cream or do painting. All sorts of different activities can happen at these. So again, you do not need anyone's permission to start a memory cafe. But if you want to and you want us to know about it so that we can share it, please let me know. And so I'm happy to share your flyer, share it out with my connections so that you can see some attendance and get some engagement into these memory cafes. So yeah, that's what I'll say about that. Another thing that we do, apart from Dementia Friends sessions to educate our community, is there's a dementia friendly business training. So this is totally different from Dementia Friends. This is something that IU Health created. So each state kind of has their own version of a business training certification for being dementia friendly. So again, this is a certification that an organization gets. So 50% of staff have to go through the training. It's an hour and a half, so a little longer than the Dementia Friends session, but really talks about, what is dementia, the signs and symptoms, but how we create a physical dementia friendly environment. So like things like noise, signage, bathrooms, color contrast, all these different features that you may not think about that might affect someone living with dementia in your space, but there are different accommodations and things that you can do to make your space more welcoming for those living with dementia. So that's what we talk about in the training. So we do these trainings in person, virtually, or there's even an asynchronous module that people can totally do on their own to get to this 50% requirement. And once you hit 50%, you are officially a dementia-friendly location. We'll recognize you on social media, on our website. So we have a listing on our website as well for dementia-friendly locations in our area. So if you're looking for dementia-friendly locations, you can check out our website to find that listing.
Is
But
this a
yeah,
cost to the business or?
no, it's totally free. Great
a-
question.
And what if it is a business that doesn't have necessarily a location that clients come to, but it goes to clients?
Yep, you can still do it. So like if you had like a home office or something like that, you don't necessarily need to have a physical space to go through this. You
Okay.
just have to go through that training. So yeah, I mean, we've had home health companies, go through it and, wherever they want to put up that decal, they're more than welcome to.
Okay. Well, very good. Thank you.
Yeah, absolutely. And there's even a level two part that businesses can do for this business training, where we have someone living with dementia walk through their space and give specific recommendations and suggestions and what's easy and what's not. And they don't have to necessarily implement all those recommendations, they just have to be willing to receive them. So the level one is really just going through that education training, and then the level two allows them to really apply what they've learned. So here in Indy, we have two level two locations, the Hamilton County Health Department and then Stillwater's Adult Day Center. But we have like over 30 businesses, I think, just in Indianapolis alone that have gone through the level one, including like some of the Indy Public Library locations too. So if you want to see more of that list, you can check out the website for that. But that's another thing that we do as well. So if you're interested in the business training, you can also just email me and I'll get you connected. And this business training happening all over the state as well. So if you're non-Indian, you're wanting to do it, you can contact me and I'll connect you with the person that could do it in your area. Right. Here's the Fall Festival. So, our next really awesome community event is coming up Wednesday, October 8th. Again, this is just a fun community event for all community members. So, we'll have a quiet relaxation area for anybody that needs it. So that, again, that this can be a welcoming and accommodating space. But at the Fall Festival, all of our vendors will have a fun activity, game, food, something like that at their table, along with resources. So it's more than just a resource fair. We'll have food provided, lots of awesome things happening there. This will be our third time hosting it. And we usually have about 100 attendees come our way. So if you want to come, you don't have to register, but it's encouraged so that we know how many people are coming. You can register on Eventbrite. It's totally free event. Again, just fun for the community members to learn about different resources, but also just have a fun day doing fall themed activities. So this is at U Indy. And yeah, if you're wanting to come, please join us. And different ways to just stay involved with what we're doing here. So you can attend or request or host a Dementia Friend session for your organization. Again, all the different dementia events that we do are posted on our events calendar so that you can stay informed. If you're interested in becoming a Dementia Friends champion and giving these Dementia Friend sessions to families, different groups, let me know and we can train you on that. And again, we also have the business training. So if you're looking to engage in that, you can also email me and get involved with that. Again, you can attend our different community events, but also please share the word. So if you know someone living with dementia that could benefit from attending a memory cafe, share this resource with them so that they're aware of it. I think the biggest thing is just getting the knowledge to the people that we want to get the knowledge to. So please share this information, share the Fall Festival, and please come and join us because all community members are welcome to come to that Fall Festival there. And then these last three here are just general dementia tips. So, right, just offer support to people living with dementia and their family and caregivers, right? Asking those care partners, what can I do to help you? And if you're a care partner, define what you need. It doesn't need to be everything, but be able to say, I need you to sit with mom for an hour. I need you to pick up this medication. Whatever that small task is, be able to define it and share it with others so that others are able to help you. We want to stay in touch and be patient with those living with dementia, right? And if anything, just reframing how you're talking about dementia. Like, notice I've been saying living with dementia, saying the words like condition rather than disease, just different ways to make things more positive. There's already a ton of negative stigma associated with dementia. So just trying to, be uplifting and positive with it, right? People can get cancer or diabetes, and they're not looked at any differently. They're supported and uplifted in the community. But for those living with dementia, it's not the same reaction that they get within the community. They feel fearful to share their diagnosis. And that's not how it should be in the community, right? So, really just trying to, reframe how we're talking about dementia and really reduce the stigma associated with it.
I think that a lot of people, if they haven't, haven't really experienced it or haven't dealt with, have maybe gone through dementia friends or what have you, I think a lot of them are just afraid. They don't know what to do or say or how to handle it, and dementia
Mhm.
presents so many different ways that it's very
Absolutely.
difficult for people to know how it works.
Yeah, absolutely. There's the saying, when you know one person living with dementia, you know one person living with dementia because progression can be different, symptoms can be different. And we really want to present this information so that it's not scary to people. Like, I've gotten that comment before, like, I feel like I'm getting scared by this. Well, I don't want you to be scared by this information. I want you to be informed, right? So that if you notice it in yourself or others, that you can, detect it and get that early diagnosis, because that's super important with treatment and progression. Because if you notice it early, there's clinical trials, there's different things that you can do to really help slow that progression. Of course, there's no definite cure to any dementias, but there's different, therapies and things that you can do to, help yourself. Also, just different brain health activities too. Like, all the healthy things for your heart are the same for your brain. Um, so yeah, wonderful.
Well, we, personally in our lives, I've got a family member that's got Parkinson's and
Okay.
advanced Parkinson's,
Mm-hmm.
and does not have dementia per se, but something has started presenting itself here recently that we finally, I really wasn't aware was a Parkinson related issue, but that there's sundowning for that disease as well. And
Mm-hmm.
so it started becoming almost every day at 5 o'clock ish crisis was going on. And temporary, well, so far we tried something. We ended up putting two new lamps in her apartment
Mm-hmm.
with timers that come on at noon and stay on till 10 o'clock to 10 o'clock at night. And
Mm-hmm.
it really has pretty much lowered that down significantly because there's not the shadow, because her windows all face east, so she's got great light in the morning, but then
Mm-hmm.
by mid-afternoon it's starting to go away.
That's awesome. That's a great strategy to help with sundowning, having those timers. And yeah, you bring up a great point with the Parkinson's. So, like, Lewy body dementia and Parkinson's like have the same kind of diseases of the brain. So that's why you might see some of those symptoms mimic. But yeah, there's a lot of similarities with it for sure. And definitely important to be informed about things like Parkinson's. I know our in the Indiana Parkinson's Foundation is going to be at our fall festival. So they're a great partner to have, and are giving great information out to the community. It's wonderful. So I'm going to spend the rest of the time talking about resources. So we work really closely with the Alzheimer's Association. So I want to just share the stuff that they do. There's a 24/7 helpline that is manned by master level clinicians to really help. Sorry, this thing makes it go automatically. That are really there to answer any sort of question. So at any point in night, it's 3 a.m., you're having a situation with maybe a behavior of someone living with dementia and you need assistance with that, you can call this 24/7 helpline and they will assist you. You can see here what keeps trying to show up is the different education programs. Oh, I thought I had that slide in there. I guess it didn't. The Alzheimer's Association does a lot of different education programs about specific dementia topics like managing money, the different 10 warning signs. So if you're looking for like a specific dementia topic to learn about, you can go and reach out to them, and they have different education programs. And then communityresourcefinder.org is a great resource for not only people in Indiana, but any place in the United States. If you're looking for care support groups, anything, you can check out that website and be connected to different resources, like the Alzheimer's Association support groups that are going on. There's also a ton going on in the Indianapolis area. So if you're looking for that listing, let me know and I'll send you the flyer with all the different support groups on it. And then just going into some different resources here. So there are different organizations about Alzheimer's specifically or other types of dementia like Lewy body, frontal temporal dementia, all those sorts of ones. So you can learn more about those specific types of dementia at those resources, because dementia is really that umbrella term. There are hundreds of types of dementia. There are even pediatric dementias. So, Alzheimer's is just one of the most common types of dementia. The Indiana Alzheimer's Disease Research Center is a really great resource for education. Also, clinical trials, they're doing lots of different ones there. And then also the CICOA CareWare program that I mentioned earlier, our caregiver support. We have specific dementia care coaches within CICOA. So all of our caregiver case managers are trained to be dementia care coaches. So again, if you're dementia, if you are a caregiver taking care of someone of any age with dementia, you qualify for care coaching. So just let you know that. You can refer yourself online or via phone number for those CareWare services. Just some other ones here. So Dementia Friendly America, right? That's the head honcho that oversees all these different programmings across the state. They even have a memory cafe directory on there, which I have listed for memory cafes nationwide. So you can look at that as well. The Dementia Friendly Indiana Communities website is listed here. That business training link, if you want to do it asynchronously, that's linked here as well. So if you do want to do it asynchronously, you just need to have someone be that point of contact who can collect those certificates to then send to me, and then we'll go from there with the certification. And then also the Dementia Action Alliance is a really good group for people living with dementia. They have different support groups, different webinars, and ways for you to really get involved with lots of different people living with dementia across the country. Okay, I think that's it. So thanks so much for the opportunity to speak. And yeah, if you have any other questions
Well,
that you need to see,
I
happy
think
to
this was a
answer.
great presentation. One thing I was going to say is one of the things that I see all the time as a senior service provider. So I'm in people's homes and dealing with people and their families
Mhm,
and trying to help. What we do is we help them, downsize, pack, move,
mhm,
sell off their stuff. So we're in that stage where they have made the decision it's time to downsize or what have
yeah,
you. But it's much, much more common than I would like to see, where it's very clear when you're working with a person that they have a dementia of some sort. Okay. But it doesn't seem like it seems like the families a lot of times are absolutely refusing to see it.
yeah,
And you it's very complicated trying to figure out how to navigate through that, trying to figure out how to, the family waiting for a cogent, logical decision from the parent is not going to probably happen. Okay. And you're trying to navigate with the kids who just get irritated with the parent because, they want to see the parent as they were rather than as they
yeah,
are,
exactly.
and I mean, we had 3 cases like that last week. So it was just, you know,
Mhm,
you're trying to figure out a way to weave through that process and get them in a safe, or they'll come in and all of a sudden they take, mom may need much more care, but they price out senior living, so they move mom into an independent living type thing, and you're going, that ain't going to work at all,
mhm.
but it's just, it's what I'm saying is if I see that much of that, I'm sure that's pretty prevalent.
Oh, yeah.
And how do you try to reach out to families to try to help them understand what the circumstances they have in front of them?
Yeah, that's a great question and point to bring up. It really comes down to stigma, like the family, embracing that stigma, and, also just having to accept that parent's going to be different. Whoever the loved one is, there's going to be differences to them. You may see people living with dementia do different behaviors like cussing or just, maybe being inappropriate or things like that. Well, that's because the social standards in their head are different than what we're thinking of. So we have to be accepting of that, and we have to be able to accept that this person's going to be different. How can we still support them and love them? Maybe mom or dad might not remember the facts of situations and things, but they're going to remember the feelings of love, happiness, or similarly, the feelings of anger or confusion. So, right, if we're trying to reorient them and be like, Mom, it's not this, Mom, I am blank, and we're getting upset and frustrated, they're going to feel that too. And it's going to make them more anxious. So, we really have to help the families get over their own stigma and, really understand that people living with dementia are still people, part of our community. They may just be acting differently than what you may be used to. And it's how do you accommodate that and still be accepting and loving for them, right? So really just, doing these like dementia friend sessions with families and just helping them really like understand dementia, I think is really helpful because there's a lot of knowledge and, stigma associated. And you have to be willing to accept, right, that mom's going to be different, but we can still have her a part of our family and still love her and support her, you know?
Yeah, it's just, and then it's just getting word out and getting people to understand it and get people to look. But
Yeah.
I think a lot of people just don't. It's kind of like they want to do the three monkeys, put their eye, cover their eyes, their ears, and their mouth, and just like la 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 la. It's it's not happening, and that's the biggest challenge, especially when you got adult kids that are in that mode when they're looking at a
Yeah.
parent.
Absolutely. Yeah. I think it's just their own internalized stigma. They're maybe not understanding what living with dementia can actually look like. It doesn't look a certain way, right? Like there's a lot of people still residing in their homes. There are people living with dementia that are driving and they're still part of communities. Like it's not a certain way that it has to look, and you have to be accepting of that and still being able to, find what strengths and interests that the person can still do. Because there's a lot of things that they can still be involved in. There might just be, a certain tweak. Maybe we have to get something out for them or, write a list so that they're, reminded of the steps. There's different, ways that we can accommodate for some of the challenges that they may see living with dementia. It's just being willing to do that for them and not, having your own stigma, feeling like mom needs to look a certain way. Well, that's, not the case anymore. Just be loving and accepting of the person for what they are, and notice that they can't change anything about it, right? Like that's also a thing. You have to accept that it's an incurable disease, and it's not something that discriminates either. Dementia can affect all of us at one point or another, even if it's not personal. It might be professional or just seeing it in the community too, like a neighbor or something like that.
One of the things that I learned in Dementia Friends that I have repeated 1,000 times since then is, trying to, because the imagery made so much sense to me when I heard it, was when you're looking at someone who has dementia, Alzheimer's, what have you. If you look at them like a bookcase, and the top shelves are the ones that, in an earthquake, the top shelves are the ones that everything's going to shake off first, the more recent things. The things that
Mm-hmm.
are at the bottom are the ones that will stay with them the longest. And that was very helpful for me to kind of get a grip on what you see out there.
Absolutely. Yeah, I love that example. And there's even a personal example that I always give when we get to the bookcase story. So, like when I was a home health aide, I was doing all my best efforts to get someone living with dementia to take a shower. And just things weren't working out. She didn't really feel it. She was starting to get agitated. I felt myself getting a little agitated. So I took a second, took a break, realized, okay, we're probably not going to get into the shower. That's okay. Maybe it'll be a bed bath, whatever. So took a second to, calm down, take a break, came back to her. And she looked at me, she's like, did I make you upset? So again, it's like those emotions and feelings of being confused, those, the conflict stuck with her, but she didn't exactly remember the facts or why. So I think that's super important to just, express to families. Like if you're giving confused, if you're trying to fight with them and say, no, you've already said this or, whatnot, and try to argue those things, they may not remember why, but they're going to remember those feelings. And you're just going to, that's not fun for anybody. Like, there's also an example I'll give, like, people living with dementia might have delusions or hallucinations. So, like, they might, look out the window and say, we're at the ocean. I'm not going to say, hey, we're in Indiana. I'm going to say, whoa, that's awesome. Like, what are the waves looking like? If it's not hurting or harming anybody else to be in that reality, it's not always something that you need to correct. Right. So, just giving those examples too.
It's difficult not to, but
Mhm.
it's part of the discipline, I suppose, that is required.
Absolutely. Hmm.
Another thing that you were talking about, different things for caregivers and things like that. One of the other things that comes from the dementia friendly class was that something I think most people, and I've used this a lot and I try to caution family members who are trying to be selfless, and throw themselves into the care, is that's all well and good, but you also have to care for yourself, and if
Oh yeah.
that 65% of, or 66%, somewhere in that range, of the caregivers usually pass before the person they're caring for because of the
Mhm.
24/7, 365 nonstop stress.
Yeah, no, thanks for bringing that up. Yeah, that's absolutely so important, right? If you can't take care of yourself, how are you going to take care of somebody else? It's so important to have support, to not take on the burden of something all on your own. Again, being able to define and ask others for help when they're asking you. Don't take on all the burden. Give yourself time to have respite and do self care every day. You need to find joy in your day every day, and you need to have a really good why. If your why as a caregiver is this is my mom, whatever, that's not a good why. Like your why needs to be I want to help, or I feel like able to support her. If you're just doing it because of a reason that's not giving you joy or fulfilling you, then you need to kind of reconsider why you're doing it. Because if people don't have, pure, I guess, I don't know that pure intentions is a good word, but just strong motivation and willingness to do this for a certain reason, you'll get burnout if you don't really have a strong why and a love and passion for, taking care of whoever you're taking care of, or being that caregiver in
And if you
general.
don't do it, what I see people do is they become a service provider and no longer a family member.
Yeah. Yeah, so bad. Yeah, so important to have that support team. And that's the good thing about memory cafes, is to where they can bring their loved one. It's not necessarily respite, but they get to kind of take a sit back and like not be the care partner in that moment, be the friend, be the family member. So, they're not always having to be in that role. And it's super important to find lots of different ways that you can do that. By, things like adult day centers, home health, or also just other familiar supports, neighbors, things like that, friends. Divide up, that work of caregiving, and give yourself breaks for sure. Or you're going to resent others. You're going to resent the person that you're taking care of because you're just not feeling good yourself.
Well, it's I'm always coming in the aftermath trying to deal with people that have been
Yeah.
trying to deal with this, and so we see a lot of people who have had really good intentions but put themselves in a really bad spot. So,
hmm and it's totally okay and normal to not feel like you can handle the care. And that's why people make, transitional long-term care facilities, other types of supports, and that's okay. You have to be able to acknowledge that, know your boundaries, and if you know, can't meet the needs, that's okay. Seek out other supports from the community to help you, do that, because it's not on the caregiver to do. And it's totally valid for the care partner to say, hey, this is something that I can't provide anymore. Let me take XYZ and bring them in, you know.
well, very good. Well, thank you so much for sharing with us
Of
today.
course.
So this video will
Pleasure.
be on for a month. It will be on Facebook Live, because now Facebook dumps them after a month, which is unfortunate. But I'll have a YouTube that will be on there as well, and we also have a Life's Copilot YouTube channel where our Life's Copilot website is a cheap website, and I think I've crashed it with too many content, and so it's hard. If you try to get the videos on your phone, it just crashes. Okay, but
Mhm.
you can do it on computer. But if you just go to the YouTube channel, you've got every video that's there, and it's easy to
Mhm.
access. And I just cheated and went to a different system to get it done. So anyway, well, you'll be there. But thank you so very much, and
Thank you.
we will bump into each other around.
Yeah.
Your name came up several times today at the Marion County uh, summit we were having today. So
Oh, good,
yeah,
good.
all good too. So
Well, good.
anyway,
I
so
know. So,
yeah.
yeah, I guess I could have went if it was earlier, but I didn't plan on going. So, thanks for letting me know that. I'm glad it went well. And
All
thanks so
right,
much for the opportunity.
sure thing. You guys take care. Bye bye.
You too. Bye.